Zofran. Zofran is a pretty common medication given worldwide for nausea. So what is Zofran and what does it do to the body? Zofran blocks certain receptors within the body that cause nausea. What are the indications for Zofran? The indication for Zofran would be a patient who's experiencing nausea, perhaps vomiting as well, but we wouldn't want to give this medication to a patient who's actively vomiting, just like you wouldn't want to give any medication or anything to a patient by mouth if they're actively vomiting. The patient will need to be over 30 kilograms or 66 pounds, and they shouldn't be allergic to that medication either. A contraindication would be a patient that has PKU. PKU is an inherited disorder, disease, that prevents the body from breaking down certain amino acids. The unfortunate thing is that the Zofran that we give has that amino acid, which would then raise that amino acid level within the body. If this patient has an increased amino acid within their body, they potentially could have brain or kidney issues. Now I know that sounds pretty crazy and we may find it difficult to identify those type of patients, but I want to remind you that this is an inherited disorder. So these patients grow up knowing that they have this disorder called PKU. So if we do our due diligence in doing our 6 patient rights, we check for allergies and we do our medication cross-checks. If a patient does indeed have PKU, they will be letting us know that we will not be giving that medication to the patient. So what's a dose and how do we give it? Zofran comes in 4 milligram tablets. We're only going to be carrying one, and it's to be given orally. It dissolves easily within the mouth within a few seconds. Zofran is going to be kept within our red EMT compliant bag where we keep all of our medications. Amongst all our other medications, we'll have Zofran. We're going to carry 1 dose of Zofran. Zofran comes in 4 milligrams, and we have to ensure that when we do our medication cross-check that we do indeed have 4 milligrams, the expiration date is not expired, and that we read it appropriately as ondansetron. Please review section 1-3 or the medication protocol 9-3A. And don't hesitate to contact any of the instructor coordinators as they can also give you some more information.